Good evening, everybody. I'm thankful to the organizer teams for providing me opportunity for this Samba. Once I have the word with the organizing person that you have to be ready for the Samba, I was worried what it was that. Because first time I'm hearing that word Samba. And before that, I was only having a word of Samba in Sole movie. And after that, this is a mission started in 1985. And that is a Society of Ambulatory Anesthesia. So, I was given a topic regarding contraindication. As far as cardiac procedure is concerned, most of the patients come from neonate to geriatric group. They comes for the either diagnostic or therapeutic procedure. And most of the patient is either having a pre-existing some of the disease, some with disease, without disease, they are coming to the hospitals. But some of the disease may be associated like diabetes, hypertension, unstable angina, morbid obesity. So these are the associated risk factor. So every cardiac patient, is it necessary to go with the Samba or not? Let me find out what is brittle diabetes. So these are the contraindication. There is a high level of fluctuation in the diabetes. Either patient is having a hypoglycemia or hyperglycemia. That is called brittle diabetes. Another contraindication is patient is having some cocaine abuse or some drug, patient is on drug therapy, drug interaction. If premature infant less than 60 weeks and some of the caretaker is not at home, if you discharge the patient, there is no one there looking after either adult patient, geriatric patient or neonate patient, at that time you should not proceed. Insurance policy in India is more important because financial part is concerned. Majority of the insurance company do not have a policy to clear the claim. Only few procedures allowed like dialysis as well as chemotherapy on the daycare basis. Here what I said about brittle diabetes is it is a high level of fluctuation in hyperglycemia and hypoglycemia. That mainly due to so many factors like a delaying of the stomach emptying, drug interaction, and there is a insulin absorption, some problems. Gastroparesis is there because of diabetes. And because of the brittle diabetes, the patient is having either hyperglycemic symptoms or hypoglycemic. In both the conditions, patient is having a different kind of presentation. And because of this persistently, patient is always under the stress or depression. These are the risk factors, and overweight, then early young age patients, then patient is having a high level of stress like cardiac anesthetics. So these are the things which we have to be more careful. Second is unstable angina. Patients come to the clinic and once you find unstable angina, ST elevation, this patient may have the fluid shifting because patient is on diuretic therapy. You go for some of the interventions, some of the procedures, some of the emergency PAMI or something is needed. This kind of patient needs a little bit long hospitalization. This patient cannot be mobilized early, and this patient may need, some of the patient may need opioid therapy. In those kind of patients, you should be more vigilant in post-op period. Patient with chronic renal disease patients come with either ARF or CRF. In those patients, if you go for the procedure, the high chances of dye-related nephropathy. This patient may have high urea creatinine, patient may have anemia, patient is on dialysis, and because of that, there are so many systemic imbalance in the body, and for that you have to be more careful. Because in medical science, the two rules is there. One is the safety of the patient, and second is that do not harm the patient. The relative contraindication like some of the device like ASD, VSD in pediatric patient, most of the centers are having a routine protocols for these therapeutic things. But small child, small baby, if you go for the femoral roots, there is a large diameter of the sheath. There are high chances of post-operative bleedings, displacement of the devices, arrhythmias, and so many things. Because once you did the procedure doesn't mean that our job is over. Our job is started once our procedure is over. So post-operatively it is very important, and if patient is staying nearby, you can send. Otherwise, if patient is coming from the far distance and should not reach in hospital, it has no value to go for any Samba like formalities. The aim of the society, it is some of the centers which is having a high volume work and there is a shortage of some of the bed vacancies and all. In this case, you can plan out something in morning hours and evening hours. This Samba is mainly concerned with the low morbidity, mortality, lower chances of infection because of early mobilization, and This will cut down your surgical waitings, and it will reduce the cost because of the minimum hospitalization. And some of the patient selection is very important. The aim is the minimal post-operative physiological disturbance. Uncomplicated recovery is necessary. And these all factors depend upon type of the surgery, type of the patient. Some of the patient may have the chances of post-operative blood loss, some pain, post-operative nausea and vomiting. In those kind of patient, you have to be more vigilant. Most of the patient ASA grade 1 and 2 is fall in this group. If patient is having a pre-existing medical disease, has to be controlled at least 3 months, and you have to take proper anesthetic examination, stabilize the patient, and call for the same day of the procedure. Premature infant more than 60 weeks, you have to select if you go for the procedure. Here with the insurance, because its financial cover part is very important. Even though you can select some of the procedure, like my colleague has told, some of the transesophageal echocardiography as a diagnostic cath procedure, transthoracic in neonate, some of the cardiac biopsy, you are planning for the patient for the cardiomyopathy or post-transplant, some of the diagnostic scopy, some foreign body removal, fiber optic bronchoscopy, then EP studies, pleural tapping, and some of the patient may need a lines insertion like infective endocarditis, then TPN and all. And some of the lines for the dialysis and central venous catheter, you can select that patient. And mostly before the selection, you have to be more careful whether you are discharging the patient with risk or without risk, and if anything happen, you are ready in time to treat the things or not. Thank you so much.